A new debate is brewing around mask requirements after a new study found mixed results when it comes to their effectiveness in stopping COVID-19. And now Dr. Anthony Fauci, who was labeled the COVID czar under the Trump and Biden administrations, is facing fierce backlash after seeming to admit that the science may not back up the claim that masks completely block the transmission of COVID. In an interview with CNN, Dr. Fauci said this. He said, quote, "When you're talking about the effect on the epidemic or the pandemic as a whole, the data are less strong, but there are other studies that show at an individual level, for individuals, they might be protective," end quote there. While scientists don't know exactly how effective masks are, Fauci insists they can help people with compromised immune systems stay safe. Researchers later clarified while they don't know how effective masks are, it is unfair to say that masks don't work. So joining us now is Professor Peter Pitts. He's the former Associate Commissioner for the FDA and President of the Center for Medicine in the Public Interest. Professor Pitts, thanks for being with us.
My pleasure. Thank you.
So there are a lot of unhappy people with Fauci's recent comments, calling him a liar, a fraud. In your opinion, is that fair criticism, or do you offer him some grace, seeing as how we hadn't been through a pandemic before?
Me personally, I don't care one way or the other. I think what's most important is that we do the right thing going forward. When it comes to masking, it's not a binary, it's good or it's bad, or it works or doesn't work situation. For some people who are immunocompromised or have respiratory issues, it's certainly helpful. The data is spottier for school-age kids. The data shows that for kids who stayed home versus kids who were in school, the infection rate was more or less the same. But what's most important to recognize is science evolves. We learned a lot during the various phases of COVID-19, and we also learned that viruses mutate. And the current iteration of COVID-19 is not the same as the original one that killed so many people. It's much more mild. And the real issue here isn't masking, it's making sure that we all get vaccinated, if we've already been vaccinated, to get boosted. So, all the ado about Tony Fauci, I think is more political rather than about science and public health. So we better get with the program and do the right thing going forward.
So tell me, though, what are people and Americans supposed to do with that back and forth, though? I know you're not talking about his comments directly, but for a lot of Americans who did look to him for answers and information during the pandemic, now there's a back and forth because he admits there's a lack of evidence, a lack of data in favor of mask wearing, but then says people should think about using them to mitigate the uptick in infections that we are currently seeing. So what are Americans supposed to do with that?
Well, again, masking is helpful. It isn't the only thing we should do, and it isn't 100% effective. In fact, we don't know exactly how effective it is. If people choose to get masks on because it makes them feel secure, I think that's fine. People don't want to get masked. I think that's also okay at this point in time, especially because we're not dealing with a virus right now in its current manifestation that is deadly. It's simply very contagious and very inconvenient. Nobody wants to get sick. And again, I want to keep stressing the importance of getting vaccinated and getting boosted, because while masks are okay, the data is inconclusive. The data is extremely conclusive about the safety and efficacy of getting vaccinated.
And speaking of that, with COVID rates rising as kids head back to school, we've seen some schools implement COVID-era protocols, including the masking. Also, I know more than 100 colleges are telling students you have to get vaccinated or else you might get disenrolled. Do you expect to see those kinds of measures start to be implemented widely again this year or any time in the future?
I think one of the key lessons of COVID-19, and if we don't learn it, shame on us, is that mandates don't work. When you tell people, do what I tell you to do because I'm in charge, people push back, and that's unhelpful. I think we have to really focus on health literacy, on educating people as to why getting vaccinated is doing the right thing and what viruses do and don't do. I think when people make their choices based on solid health education, they end up doing the right thing. And I think it's incumbent on federal, state, and local officials to ramp up educational efforts. And that's twice as true for educational facilities who actually recognize and value education.
Yeah, I do think you're right, and that people are tired of being told what to do, especially when there's a bit of an about face from the man who was at the forefront of COVID-19 for several years. Professor Peter Pitts, thanks so much for hopping on with us. Do appreciate it.
My pleasure.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.